Hello everyone, I'm the author of this article Fighting Stress with Root Canal that was published in the International Journal of Science and Research in 2019. I'm Dr. Vashisht. I'm a final year postgraduate student in School of Dental Sciences from Sharda University. Now, oxidative stress. It is a state in which oxidation exceeds the antioxidant systems in the body, secondary to the loss of balance between them. And we can correct this oxidative stress according to several literature by performing the root canal treatment. Now, stress nowadays is a common finding, irrespective of the age, gender, or even the profession of an individual. Depression, aging, together with various systemic problems, has got association with the production of free radicals within our system. At lower concentration, free radicals play a vital role in physiological regulation and cellular signaling process. But when these free radicals are present at higher level, they can cause deleterious changes in the cell. Now, oxidative damage caused by these free radicals includes generation of superoxide radicals. Now, these are related to cardiovascular diseases, hypertension, cerebrovascular diseases, macrovascular diseases, and many more. Now let us see what is the association between the inflammatory conditions and the oxidative stress. Now there is immense amount of literature that supports association between inflammation and oxidative stress, and both of them go hand in hand. Now research has revealed the mechanism by which continued oxidative stress can lead to chronic inflammation, which can in turn could medicate most chronic diseases including cancer, diabetes, cardiovascular, neurological, and even pulmonary diseases. Inflammatory process induces oxidative stress and reduces cellular antioxidant capacity. In addition, free radicals can lead to mutation and DNA damage that can be predisposing factor for age-related disorder and even cancer. Now let us see how dental conditions and oxidative stress they are related. Now dental problems such as caries are quite common. Apical periodontitis is an inflammatory disease that is affecting the periradicular tissues, and it is occurring from the bacterial infection of the dental pulp. It is most frequent sequelae of untreated dental caries, and it may frequently result in tooth loss or situation calls for root canal treatment. Now several studies have been carried out concerning this association of oxidative stress and apical periodontitis. These studies have described pro-oxidant status in apical lesions of apical periodontitis patients and the influence of endodontic treatment on systemic oxidative stress. Chronic apical periodontitis are exposed to a condition of higher general oxidative stress as compared to the individuals that are not having chronic apical periodontitis. Now this is extremely dangerous for the general health, and the condition of oxidative stress shows its primary action near the site where it is present. Now, several scientific evidences have shown that oxidative killing carried out from the neutrophils against the pathogenic bacteria is frequently the first stage of bone damage, especially in some dental pathologies such as acute apical periodontitis. Neutrophils from the peripheral bloods of acute apical periodontitis subjects, they have shown to increase the production of hydrogen peroxide and superoxide anion, that is the free radicals. So there was a recent study in which Ishiguro, he concluded that the patient with chronic apical periodontitis have significantly higher level of oxidative stress than the healthy patients. Proper root canal therapy in such patients tends to reduce the level of oxidative stress and return to the normal by 90 days following the treatment. Now the subjects that are affected by chronic apical periodontitis are exposed to a condition of oxidative stress which is extremely dangerous for the general health. So it was inferred from the findings that through proper endodontic therapy, a good oxidative balance can be restored. Thereby we can avoid the risk of contracting the mentioned diseases. So in conclusion, a proper dental treatment and early intervention in the form of root canal procedure can actually reduce the systemic oxidative stress and can help in improving the overall general health of an individual. Oxidative stress level, they depend on one hand on the bacterial infection related inflammation and on the other hand the protective power of the antioxidant system in our body. Eradicating the inflammation with the root canal therapy can actually help in improving the stress condition. However, further studies they need to be carried out in order to highlight the influence of various dental procedures on the patient's oxidative stress level. Thank you.